friends, welcome back. Let's discuss about nephritis. What do you mean by nephritis? It's nothing but it's the inflammation of the kidney and may involve glomerular tubule or the interstitial space which surround this glomerular tubule. And next we can learn what are the types of nephritis. What may be the types of nephritis? First one is glomerulonephritis. Glomerulonephritis is the inflammation of glomeruli. That is, the glomeruli is made up of number of blood vessels, and these knots of blood vessels will help to filtrate the blood and remove the excess of fluid from our body. If there is any damages or inflammation occurs to this glomeruli, it results in decreased glomerular filtration rate, and the person may experience proteinuria, hematuria, oliguria, increased hypertension, and azotemia, edema. The second one is interstitial nephritis. It is the inflammation of interstitial space which surrounds this tubule. It occurs as a result of allergic reactions to some medications or overdosage of some medicines. They are allopurinol, penicillin, rifampicin, proton pump inhibitors, cephalosporin. And the third one is pyelonephritis. It is the inflammation which occurs as a result of urinary tract infection. If urinary tract infection is not treated properly, the infection may migrate from ureter to the kidney. And the fourth one is Alport nephritis or hereditary nephritis. It's the nephritis which transfers from generation to generation through gene. During this condition, the person may experience impaired vision and hearing problem along with this hereditary nephritis. And the fifth one is lupus nephritis. Lupus nephritis is nothing but it's an inflammation which is caused by lupus systematic erythematous. That means it is an autoimmune disease. That's all about the types of nephritis. Next, we can see the signs and symptoms of nephritis. The first one is the person will experience burning and painful menstruation, increased frequency of menstruation, cloudy urine, frothy urine, hematuria, hypertension, edema, that is swelling over the face, ankle and feet. And also there will be vomiting and fever. Along with all these symptoms, the person may experience vomiting, fever and vomiting also. Next, how we can diagnose this nephritis? Simple method is urine analysis and urine routine test. Through this test, we will be able to identify whether there is any RBC cells or WBC cells in urine, pus in urine, and also it helps to give an idea about the urine osmolality, urine concentration. So it will help to identify whether there is any infection for the person or not. And the other one is intravenous pyelogram and CT or ultrasound, renal ultrasound. It provides a clear picture about if there is an inflammation or blockage in occurs in renal to a kidney or in glomerular tubule and all. And the other one, some of the doctors will advise to do immunological tests like anti-glomerular basement membrane antibody test and anti-nuclear test, anti-neutrophil cytoplasmic antibody test. All these tests will help to identify whether there is any autoimmune disorder or anything. How we will be able to treat this nephritis? Initially, we will treat with antibiotic, corticosteroid and angiotensin converting enzyme inhibitors to treat hypertension, and plasmapheresis is also used in some case. And the patient condition is severe, sometimes the doctor may advise to do temporary dialysis. That's all about nephritis. Today we have discussed about nephritis, its type, clinical symptoms and diagnostic measures, and how we will treat this nephritis.
Please subscribe and press the bell icon to get further notification.